after 7:15 this Monday morning. A warm welcome to you if you've just tuned in. Health Minister Dr. Phaahla says it's still too early to ease COVID-19 restrictions from alert level 3. That says over 10,500 new daily cases and 170 deaths have been recorded over the past 24 hours. That's logged a test positivity rate of 20.7%. On the other side of that, over 10.5 million vaccines have now been administered, and just under 5 million people are fully vaccinated. Let's get you more on the country's COVID-19 strategy. We're joined now by Health Minister Dr. Phaahla. Dr. Phaahla, it's great to have you with us on the show this morning. Thanks very much for your time. No doubt a good time to include the 18-plus cohort in the country's vaccination drive from last Friday. In fact, the President, you would have seen in his weekly newsletter, also applauding that age group for showing up in their numbers over the weekend.
Well, I think it was indeed quite a timely acceptance of the 18 to 34. And as we said, we've now reached a stage where we had enough capacity to can open up for all adult population of South Africa. Mm-hmm. As you know, we started a bit slow because of availability, but also building up our own capacity to be able to vaccinate. By last week, we all agreed, I had to consult with my colleagues in the provinces, and we all agreed that with a stable supply and with expanded capacity in terms of actual vaccination, we were now ready to open up for all the adult population of South Africa. And we're indeed very pleased that on the first day we had a very good turnout of the 18 plus.
I mean, Minister, by all accounts, the big challenge now is getting the right information out there insofar as vaccines are concerned. Before you opened up this age group, the 18-plus cohort, those aged 35 to 49 saw a big increase in the number of people showing up at vaccine centers. But then those numbers tapered off very, very quickly, with very few people showing up for their vaccine. How do we now ensure that we get the right information out there to ensure that the 18-plus cohort doesn't see that same decline in the number of people getting their vaccines?
Well, Michelle, I would say that we would take responsibility as a health department to play our role. Largely, I would say, across the value chain. Our first responsibility is to have the capacity. And as I've mentioned, that we've been able to build up in terms of making sure we have supplies so that we don't run out. We have the necessary capacity to actually give the vaccines to the people that we have now. But of course, thirdly, we need to sustain that, but we accept the fact that also in terms of making sure that people have the right information, we should be leading. Mm-hmm. We have done that. Maybe we need to increase that, working together across as a health from national to provinces, but also across government as a whole. We're working very closely with the government communication and information systems, the GCIS, but also across government as a whole, from all the spheres, municipalities. We're communicating with the mayors and the premiers and getting everybody to really play their part. But I would also conclude by saying, at the end, the success is going to be all of society, that we should all pull together. Government alone will not win this battle.
No, sure, Minister. Yes. I mean, I think we accept that it's a societal challenge, but in the main, it is government's responsibility to ensure this kind of communication campaign does happen. And in the main, your department would be responsible for this as well. And the communication campaign needs to be targeted, doesn't it? It can't just be in English. It needs to be in our official languages as well. What can you tell us about reports around the money around communication being an issue, that we don't have enough money insofar as rolling out this kind of communication campaign is concerned?
Well, as you would be aware, we're still dealing with the challenge of just the legacy, which we're still, cleaning out.
Are you talking about the Digital Vibes contract?
Well, yes. I mean, we can't ignore the fact that something, I mean, as you know, things didn't go well in terms of that first initiative. But that doesn't mean that, you know, we've got no other plans. We are, you know, working, as I'm said, we are working with GCIS. We are ramping up the communication, and including what you have mentioned about making sure that we communicate across all languages. That's already happening. There's translation, not only in terms of community radios, all various language stations across the country, all 11 official languages. We also have a number of community radio stations, which we are also utilizing, but also making sure that even written materials are also in various languages. We have not yet reached all 11. I think at this stage, working with GCIS, we've been able to translate our materials into 5 different languages. So all those are on board. I mean, we can't spend billions of rands in terms of acquiring the vaccines, paying staff to be at the stations, mobilizing private sector, and then fail to communicate. So that's the matter. And I must also say to you that we're very grateful, because across all platforms, your own station, you know, the other TV stations have come on board to offer, you know, time slots. So we're ramping up that. We're working with even, you know, those who are broadcasting, not necessarily news. Last week we had a discussion with one of the channels which is doing sports, and they've also come forward to say we are available and we're working on relevant material, which will also can be transmitted by also sports stars.
Minister, can you take us through the current COVID-19 case trajectory? I mean, we're still seeing tens of thousands of new cases every day when we get that update from the NICD and from your department. The new infections are still incredibly high, as are the number of new deaths we're seeing on a daily basis as well. Minister, what is behind the current trajectory?
Well, the Delta variant, in fact, let me say its variant, I mean, now we're learning. As you know, I've often said that this is a new disease whose pattern nobody can really claim to be ultimate authority. It keeps changing. But it's very clear that each variant has its different pattern. And this Delta variant has come with a very complicated pattern, as you would know, starting in Gauteng at very high numbers. And then now, clearly, the interior provinces were the first together with Gauteng, and now it has moved into the coastal provinces with the Western Cape at the highest level. At some stage, I mean, I was in the Western Cape on Friday, and when we looked at the trajectory there, it peaked and then looked as if it was now going down, and then it just peaked again. So, but we're very hopeful that this week, Western Cape will start to have constant decline, but quite clearly KZN will be rising. It's already overtaken. So our projections now is that we're going to have still very high numbers this week and next week, driven by a declining Western Cape, but a rising KZN and a rising Eastern Cape. So, our own projection is that we're still going to be at high numbers, possibly right up to the end of next week. So it does look like, hopefully, once the coastal, because the interior provinces have already declined and it's sustained decline. So we expect that in the next 2 weeks, the coastal, we believe Western Cape has peaked and is going to constantly decline, but KZN has not yet peaked and Eastern Cape has not yet peaked. We do have provinces which are just stubbornly remaining at a fairly high level, like the Northern Cape, and we're working with them to see the clusters in the Northern Cape. Is the only province which has had very sustained high levels. So, but we are hopeful that by the middle of September, we should have a constant decline of the whole country on this type.
And of course, the advice is always to maintain the non-pharmaceutical interventions and, of course, to get the vaccine. You talk about a decline that we're hoping to see will continue around the country, Minister. In the same way, we're also building up to a fourth wave of infections. Analysts tell us come December. You know, what can you tell us about our hospital capacity our nursing staff, our frontline workers, and what's being done, to support them insofar as going into year 2 of this virus?
Well, clearly our hopes that, after the first wave, second wave, that there will be just a constant low level and we can be able to sustain that. Those hopes have clearly been dashed, not only in South Africa, but if you look at the pattern all over the world, all countries are experiencing the same kind of waves. So we really readying ourselves now for the inevitable fourth wave. The question is when, possibly December, as the projections are showing. Mm-hmm. We believe that at this stage, in terms of hospital facilities, we have shown that there is resilience throughout both the public and the private health facilities. We need to sustain that. The hopes, what we had last time, where we sometimes, after the second wave, thought that it's going to remain at a low level, it's not happening. So going from here, we're going to have to sustain the capacity in terms of all the oxygen, all the bed capacity. But what is the problem is, of course, the fact that our frontline health workers are really very fatigued.
Yeah.
So we're going to have to find ways to recruit more, especially on the nursing side, so that others can be able to take leave. Others have not taken leave in a very long time. But what we are grateful for is that since the Sisonke vaccination in February and March this year, targeting the health workers, that has really helped, because in this third wave, we have had fairly smaller numbers in terms of health workers who have fallen ill from COVID. So that has been very helpful.
Yeah, I suppose the next question, Minister, as we talk about, our own preparations for a third wave of infections is, are there fourth wave, pardon me, thank you, Minister. Are there discussions now around making vaccines mandatory, at least for some sectors?
That's a difficult topic. We would wish that it doesn't get to that our South Africans just understand the value, as you've said, and we've said earlier on, maybe, as we ramp up our communication, deal with the fake news. The question was, we are in a constitutional democracy, so each person has their own human rights. We've got to respect that. So the question of mandatory is going to be quite a difficult one. Maybe it might happen at workplaces. It will probably be challenged. So we're not banking on making vaccination mandatory. We're really banking on just convincing all adult South Africans that it's good for you and it's good for your family and your community to vaccinate. We're not really banking on just understanding our architecture of our constitution. The mandatory aspect of it will be very difficult.
Minister, just a quick comment from you, if you can, around the possibility of local government elections, depending on what the Constitutional Court says, going ahead this year still.
Well, we're all crossing our fingers, because we all hope that we can ramp up vaccination and get out of this third wave. And if by the time the predicted fourth wave comes, at least 60 to 70% of adult population who are the voters are protected, then so that February period, as targeted by the IEC and retired Judge Museneke, was working fairly well in terms of our own projection of population immunity. But as we hear from the legal people that it's not given, there are complications. If it does happen that 27 October has to go ahead, it's going to be difficult, because we will just, I think the most difficult part will be when at the current moment, meetings are restricted, even political gatherings, 50 indoors, 100 outside. And this is the time when parties should be really campaigning. So it's going to be a difficult one, but if it's a court ruling, we would have to continue to guide the parties and the relevant government departments, including the IEC, as to how to still proceed within the restrictions.
Minister,
it will not be the best.
Yeah. Minister, from Deputy Health Minister to South Africa's South Africa's Health Minister in the midst of a pandemic and in the face of widespread criticism of your department's handling of communication around the pandemic under the former Health Minister, Dr. Zweli Mkhize. How has that transition been for you?
Well, it's a difficult one. I mean, it's always better when you get into a new responsibility to have some kind of time to adjust. But there's been no time. I mean, this is what, my third week now, but it's all been just, hitting the ground running. There's been no time to say, well, the fact that one has been within the department has also helped, because I understood the challenges. But when you finally, take the ultimate responsibilities, it's quite different. So it's been quite a tough one, but one is settled in the last now 3 weeks. So I'm very conscious of the fact that it's going to be a very difficult period right up to the end of the year. I'm very hopeful that we can get more, South Africans accepting the protection of the vaccines, because that would really help us to make sure that by the time we get to the end of the year and into 2022, we could really be in a better situation where we could, plan proper. Because the tragedy of this situation, of this pressure, is that other health responsibilities are also falling back. Your basic non-communicable disease, your hypertension, heart disease, diabetes, looking after the children, HIV and AIDS, TB, all those are suffering in the present moment. When I was in the Western Cape, they mentioned there are already about 300,000 backwards in terms of planned surgeries which have been put back. So we need to claw back in terms of all that lost ground. And hopefully, if by end of this year, we are a bit stable, we could then get back to a normal health work.
Yeah, it's arguably one of the biggest jobs in the country at the moment. Dr. Joe Phaahla is South Africa's Health Minister. Thanks very much indeed for your time this morning.